Well, hello, everyone. My name is Timothy Caulfield, and it is my pleasure, my great pleasure, to be chairing what I think is an incredibly important panel on civil liberties and COVID. And in fact, I think this is becoming an increasingly important topic. Indeed, people are marching in the streets about this. You know, we're seeing this topic being raised increasingly. And of course, what I'm talking about is the balance between civil liberties, often framed as freedom, as rights, versus the strategies that we need to adopt, these public health strategies that we need to adopt to fight the pandemic. This has become a really tense topic, and I think it's one that is going to become increasingly important as we deal with things like vaccination, as we deal with things like mask mandates, and as we try to balance even economic issues against, as I said, all these strategies that science tells us we need to adopt in order to fight the pandemic. But of course, what this really is that this discussion about, I think, in many respects, balance. You know, how do we strike that balance? Well, today we have, as I said, an incredible panel, the exact people we need to drill down and to explore this topic. It builds on a wonderful report, Royal Society of Canada report that was led by my friend, my colleague, Colleen Flood. And it is a report that really tries to map where we need to go, you know, what the facts are around civil liberties in this context. And so we're going to talk about all of that. I'd love to hear your thoughts, love to hear your comments. So how's this going to play out? We're going to have some brief statements from all of our wonderful panelists, and we're going to keep this casual. We're going first name basis, and they can tell you a little bit about themselves before they give us a sense of what they see as some of the urgent issues that we need to touch on, and then we'll open it up for discussion, for commentary. So, Colleen, let's start with you. You know, map this out, draw, paint us a picture, and tell us what you think some of the key issues are here. Over to you,
okay,
Colleen.
Sure, thanks very much, Tim, and I'm really thrilled to be part of this incredible panel. As Tim said, I co-authored this report for the Royal Society with my colleagues, Professors Brian Thomas, Vanessa McDonnell, and Dr. Kuman and Wilson. And that report is available on the Royal Society website, and you can download it for free. And we'd love to hear your thoughts on what we had to say there. So I've only got a few minutes, and so I'm going to start up by summing up what I'm going to talk about. So essentially three things. First, what are civil rights claims? What kinds of things are we talking about when we talk about civil rights claims? Secondly, I'm going to explain that in Canadian law, a claim in civil rights is not trumps, and it is possible for the government to defend such a claim on the grounds that the whatever it is they're doing, the precautionary measures for COVID-19, are proportionate, are reasonable in the context. And then finally, I'm going to make this point that although that is the case, governments can't rest on their laurels. And as evidence evolves, and there are ways to do things that are less rights infringing, then governments have to react. So they can't just sit still. So those are the three big points that I'm going to make. And let me just unravel some of this a bit. So what are civil rights claims? Straight out of the gate, as we heard this news about a virus emerging in Wuhan, China, we saw an example, a severe example of civil rights infringement. Dr. Li Wenlang went public with his fears of a SARS-like outbreak at the time, only to be detained by the police there, forced to recant in a public statement what happened. And then very sadly, he would die of the coronavirus shortly thereafterwards. Another type of civil rights infringement we might see is grounded in privacy. So a number of countries that have successfully tamed COVID-19 have done so using electronic contact tracing. But concerns about privacy in Canada has meant that the tracing app funded and promoted by Health Canada is a voluntary one, completely voluntary, and actually only really works if you've got a latest iPhone, etc. So great for privacy, but bad for uptake and the effectiveness of COVID-19 tracing. Another example was in Ontario, the government was allowing the police to access the COVID-19 database. Indigenous Peoples, Black Legal Action, and the Civil Liberties Association brought in action claiming infringement of privacy, and they were concerned about the discriminatory enforcement of quarantine laws, which is a big issue. And the government backed down on that one and settled that, so the police no longer have access to that database. Now, I think, though, as I'm trying to explain what civil rights claims may be, it's also important to note that not all claims made under the brand, if you like, of civil liberties are in fact legal rights. For example, the right not to wear a mask on public transit or in a shop and so on. To make a claim that this is a legal right, one would presumably ground this in Section 7 of the Charter, arguing that it is an unlawful infringement of liberty. Historically, Section 7 has been used to protect such fundamental rights as the right to abortion, the right to refuse medical treatment, the right not to have to resort to suicide in the absence of medical aid and dying options, and the right to ingest medical marijuana to treat the symptoms of cancer. Arguably, a requirement to wear a mask in some public settings in the context of a pandemic does not reach the level of these kinds of claims sufficient to bring a Section 7 liberty claim full stop. So not all the things that you see people marching in the streets about are in fact, would amount to civil rights claims. Now, even if it did amount to what we would call a prima facie breach of Section 7, so life, liberty, and security of the person are engaged, or mobility rights are engaged. This is the kind of stuff we talk about in charter parlance, which is enough to do your head in. But if it's engaged, then it doesn't necessarily mean that a court will overturn the government measure. So we could take a recent example involving Newfoundland closing its borders to everybody except residents and certain essential workers. In a recent case, Miss Taylor, who wanted to return to Newfoundland from Halifax, Newfoundland being her province of birth, to attend her mum's funeral, her application for a special exemption to this border control was denied. So she and the Civil Liberties Association of Canada brought a claim grounded in Section 6, right to mobility under the Charter of Rights and Freedoms. I think this case is such an interesting one to read because it really shows you the dynamic between how public health folks think about issues and how legal advocates sometimes think about issues, and how a judge has to sort of mediate these things. So the court recognizes the importance of Section 6 right to mobility, but also recognizes the essentiality of what in public health is known as the precautionary principle. And so the court wrote, the central objective of a public health practice is to intervene early and effectively to mitigate or prevent the effects of harmful agents. To the lay observer, when the desired outcome is achieved, that is a lower level of disease, these public health interventions often appear to be unnecessary or overdone. I think that's really important, right? If you're very successful in doing your public health job and you actually prevent the public health illness and the disease, everyone can say, well, you were just overreacting and see nothing actually happened. But of course, if you don't act, then terrible things could happen. So this concept of the precautionary principle is well summed up by the now almost infamous Dr. Anthony Fauci. If it looks like you're overreacting, you've probably done the right thing. And I think that's essentially the precautionary principle. Now, Ms. Taylor and the Civil Liberties Association argued that because the rates of infection in Newfoundland at the time that travel ban came in were relatively low compared to the rest of Canada, this suggested that the travel ban was not necessary or proportionate. But the court accepted epidemiological evidence offered by the government that actually it was when the rates were low that the most benefit would come from imposing a border restriction, because that would dramatically reduce the risk of reintroducing high rates of local transmission. And so I think in this case, we see the courts acknowledge the difficulties the government faces as it deals with a pandemic, often with fast changing conditions and no clear evidence about what works and doesn't work. You know, a melange of things are tried and it's hard to unpack them. And also the context of being in Newfoundland with a very high rates of elderly population and high rates of comorbidities. And so very high risk for those populations of death and illness associated with COVID-19. And so in those circumstances at that time, the court found that it was reasonable for the government to infringe on what otherwise would be the mobility rights of Ms. Taylor and others in a similar situation to cross the border from Nova Scotia into Newfoundland. Now, let me move on to the third and final point, and that is that the courts, although the courts will be deferential to a situation that governments and public health officials find themselves in when they're wrestling with a pandemic, they will require that governments evolve their measures as the evidence evolves. So it won't be possible for a government to take a hard-ass measure that potentially infringes someone's civil liberties and stick to that if the evidence evolves that actually it would be possible to eliminate the pandemic or curb the pandemic in another way that is less rights infringing. So one could foresee, for example, a challenge to severe lockdown measures on the grounds that, well, you could achieve your ends perhaps by using masking or some other kind of measure, perhaps if and when we get the vaccine on deck, using vaccines. So, and the court notes in the Taylor case in Newfoundland that the pandemic is not a magic wand which can be waved to make constitutional rights disappear, and that the decision of the Chief Medical Officer of Health is not immune from review. So as the evidence evolves as to measures to stop the spread of COVID-19, it is right, I think, that these challenges will come before the courts, and the courts will ask governments, are there means by which you can achieve your objectives without having to infringe civil liberties? Okay, so that's the end of my little spiel on civil liberties, and I just want to conclude with two kind of more personal observations really about COVID and civil liberties. And the first is, although we are seeing claims being brought about civil liberties and marching in the streets, etc., as Tim mentioned, we're not seeing really similar marches about people dying in long-term care homes. And I don't think we're going to see successful cases brought against governments for failing to act to protect the vulnerable. For example, for failing to insist on better and more precautionary measures to protect residents in long-term care homes. In part, that's because we don't have a freestanding right to health or health care under the Charter of Rights and Freedoms, at least not recognised as of yet. Perhaps there's an argument to be made under Section 15 of the Charter that it's discriminatory not to bring to bear at least the same kind of measures and resources as we do in public hospitals to long-term care settings. But those are all big ifs. And as I said, it's disappointing that people aren't marching in the streets about protecting people in long-term care homes when we're up to 11,000 deaths, and most of them are in those settings. And finally, my last comment is that when we talk about precautionary measures, we often think about now the collateral damage of those measures in terms of mental health, loss of jobs, economy, and so on. And I think, though, that we also have to be attendant to the other side of this. So we are concerned about the vulnerable from precautionary measures. We must be as concerned about the vulnerable who are the victims of COVID, the frail elderly, the racialized groups living in poverty. And so what we need are measures that vigorously attack the virus and the causes of the virus and the settings of the virus, but wherever possible, mitigate the effects on those who bear them, particularly the vulnerable. Vinny?
Thank you very much, Colleen, for those thoughtful comments. And by the way, I invite everyone, all of our participants to, I'm sure you're already thinking of things to ask Colleen to please start typing them in now so we can all start stewing on thoughtful answers. So thank you very much, Colleen. Natalie, over to you for your comments.
Yes, thank you. Happy to be here. Natalie Brosier, I'm the principal of Massey College, but I think the reason why I was invited is partly because my specialty is constitutional law, but also because I used to be the head of the Canadian Civil Liberties Association. So I can present a little bit why is the CCLA engaging in this litigation strategy. So I'll make briefly 3 points as well. The first one is I certainly agree with Colleen that there is no antagonism between the precautionary principle that government may be following and the way in which public health evolves. Indeed, I would see that the courts often have accepted the use of the precautionary principle in many respects. I think courts will want to support government action that is linked to national safety objectives all the time. And I think they've done that in the past. That doesn't mean, though, that there won't be cases being brought forward. And my first point would be, I would like people to not engage in this polarization, saying, if you're bringing a case, it's because you're a mask denier, and therefore you're not supporting the larger public health objectives. In general, we consider that everyone in society, in a democracy, has the right to seek accountability from the court, to want to test whether what's being done is being done properly. And that's a good thing. It's a good thing for the courts to be engaged in this because they are an accountability framework and they provide legitimacy. So it's much easier to continue to have a system where people feel reassured that what's going on is okay if they have the possibility of bringing cases. That does require that the courts get on board to respond in a timely fashion to the cases being brought forward. So my first point is simply, I would hope that we're not going to be in a construct where we will deny, or if any government tried to limit access to the courts, I think that's dangerous. And that's not good for legitimacy. It's not good for public health in the long run. Now, second point is, what will the court look at? As Colleen said, they certainly will be concerned about tunnel vision. They will be concerned about arbitrariness, and they will be concerned about not keeping up with the evolution of the disease, of knowledge, and of the impact. So those would be aspects that I think will be looked at. So arbitrariness, what will the court worry here would be always if a government is doing something to look like it's doing something, as opposed to responding to the way in which it should act. Probably by now, I think some ways of enriching decision-making or making sure that decision-making continues to be adapted to individual circumstances should be expected. You know, at the beginning of the pandemic, having brutal rules that applies without any exceptions may have been acceptable, but now we know that maybe you need to provide the right of appeal if you're denied, if you're labeled a non-essential traveler, so that you can at least have the possibility of explaining your case and so on. And I think the courts will want government to appear to be attuned to the fact that what was acceptable or reasonable in March or April may be slightly more, we may need a little bit more nuance. granted, you know, they will continue to want public health objective to be validated and apply. They will be concerned about tunnel vision. I think they will be concerned about the regime or the outlook not focusing too much on some things and not looking at the impact that it may have on other access to for other diseases. We know, for example, that early on in the pandemics, there was a complete ban on visitors in long-term care home. That has been reversed because, in fact, some people, and it was thanks to a couple of cases as well that were brought where people said, well, that may prevent people suffering from Alzheimer's to survive the pandemic, to deny them completely access to their own family members. Is there a way of doing it a little bit better? And finally, I think it's normal that eventually we will care a lot and we will want to have a little bit of a reflections on the blame and shame discourse that is going on, and what the impact is on people being able to access good healthcare, but also access good information. So this is my point. I think typically we expect the health system to provide solutions. You know, you're sick, you have a bad hip, we'll replace your hip. You know, you should stop smoking, use Nicorette or do something. Here in this case, I think we fear that the tendency is to repeat the same guidance. And, you know, we all know doing the same thing over and over again without and expecting a different results is the definition of insanity. So courts will want to make sure that the system works, that the public health system includes some reflections, is constantly taking on new information, is able to convey that in a way that reflects the evolution of the public, the evolution of the disease, and so on. So I think, so my point is simply accountability is a good thing. And I'll just end by referring to when the charter came in, a lot of police officers were really worried that it was going to prevent them from doing their job. Eventually, 25 years after, I remember being on a panel with a chief who said, but finally, I think the charter allowed us to do better policing. So accountability should be embraced. It does allow the system to learn and to be able to be more acceptable. Thank you.
Thank you very much, Natalie. Irfan, over to you.
Thank you, Tim. So my name is Irfan Dalla. I think I'm the only person on this panel who is not a lawyer. So this is really a sort of once in a lifetime opportunity for me to be on a panel with people like Natalie and Colleen and Tim. I'm still in clinical practice at St. Michael's Hospital, and I'm also on the executive team of Unity Health Toronto, which includes St. Michael's, Providence, and St. Joseph's in Toronto. You know, when I see the phrase civil liberties has never come up in a conversation with me and any of my patients. And I don't think it's come up in any professional conversation I've ever had. And I was thinking about freedom and what that means in clinical medicine. And actually it does come up a lot in terms of mental health and other conditions where someone may no longer have the capacity to make decisions for themselves. And so we often talk about how at the bedside, you know, when we're teaching medical students or residents, that this person is free to make bad choices so long as they understand and appreciate the consequences of those choices. You know, we take care of lots of patients at St. Michael's Hospital and every hospital across the country, lots of patients who don't make choices that are in the best interest of maximizing their health. But so long as they understand and appreciate those consequences, whether they're choices about diet, choices about activities, choices about taking their medications or not, choices about using substances, people are free to make choices that have adverse health consequences so long as they understand and appreciate. The places where we sometimes deem someone incapable and then we are allowed to defer to somebody else to make choices on the patient's behalf are situations where somebody's mental health is such that they don't understand and appreciate those consequences, or if they have advanced dementia, which might or might not be viewed as a mental health condition, depending on your perspective. What's been very different with the pandemic is, those of us who practice medicine or work in a healthcare organization have had to think about this not just from the perspective of one patient in front of us at a time, but the perspective that Colleen and Natalie are bringing to this discussion of populations. And clinical medicine is very different than public health. So let me tell you about another individual. Individual stories are sometimes illuminating. So I know a man who's in his late 70s who has a chronic lung condition called bronchiectasis, and he is, he has repeated what are called exacerbations, where he requires antibiotics to treat a bacterial infection, somewhere between 3 and 5 times a year. Once in a blue moon, one of these exacerbations lands him in hospital, but he generally takes very good care of his health and has stayed out of hospital most of the time. Most of these exacerbations end up with a bacterial infection that is treated with antibiotics, but is initially triggered by a viral infection, so influenza, cold virus, parainfluenza, another virus. And so, before the pandemic, this is the sort of person, and this is the case for this person, who was already restricting his behavior in some ways. So, would avoid crowded settings. This particular individual had stopped taking airplanes some years ago, just found that was a setting that would typically trigger an exacerbation, but otherwise was living with a very high quality of life, going to restaurants, socializing with friends, etc. This is the kind of person who, if he were to get COVID-19, his chances of dying, hard to estimate accurately and precisely, but are probably in the 10 to 40% range. As opposed to me, if I got COVID-19 as a younger person who is who doesn't have a chronic lung condition, not immunosuppressed, my chances might be 1 in 1,000, might even be 1 in 10,000, but they're certainly not 1 in 100 or 1 in 10. And so this person I'm referring to, during the pandemic, he really hasn't been able to go anywhere, right? Hasn't gone to see any friends, hasn't gone to any restaurants, is even very careful about interacting with people outside. And, this person lives in BC. And so during the summer, there were some days in BC when there were no cases at all, and was beginning to feel like some of these freedoms were coming back. And as summer has turned to fall, the two edges of our country have gone in quite different directions, with rising case counts in BC and Atlantic Canada, at least until the last week, still largely being free of COVID-19. And at this point, I think, many of us are crossing our fingers and hoping that somehow that Atlantic bubble can be maintained. And if we look at those two extremes in our country, West Coast and East Coast, and say, well, what did they do differently over the summer? Really, probably the biggest difference was this restriction on what I guess might be called a civil liberty, the freedom to travel. So in Atlantic Canada, that freedom was restricted more than that freedom was restricted in BC. So as a physician who takes care of patients, we don't really usually think about these kinds of infringements on our freedoms as having an impact on the health of the person who we are taking care of. But if the pandemic has taught us anything, it is that we are all connected, and that these freedoms do have real health consequences, as I think Colleen in particular was pointing out. And who is going to stand up for the freedom of people like this person in their 70s who has bronchiectasis? Who is going to stand up for the freedoms of the people who are living in long-term care homes and who can no longer see their children in many places, who can no longer leave their long-term care homes? some of you will have seen the column by Stephanie Nolan in the New York Times a week or so ago. She wrote about life in the Atlantic bubble, and she said, and I'll quote, "Our freedom," here, I think she was writing from Nova Scotia, "our freedom feels precious and fragile. It hasn't come cheap, but it is a steadying thing, the knowledge that we will make hard choices for each other, and that sometimes when we do, the reward is a life we recognize." And I guess the question for all of us is, what price are we willing to pay so that people who are older, who have chronic lung diseases, who are immunosuppressed, can enjoy a little bit of that life that they recognize? So thanks very much. Look forward to the conversation.
Thank you. Excellent, excellent warm up, you guys. And I'm gonna start with a question that I'm gonna really try to put a point on this. Really try to make this relevant to anyone who's listening that isn't a law professor. Colleen, what would you say? You're on the street in Calgary. There was a march yesterday. I think it was yesterday.
Yeah.
A surprising number of individuals. And this was the issue. This was the issue. The government is infringing on my civil liberties. You have a moment to speak to all of them. What would you say? What would you say to inform them about the balance?
Well, that's, I think I might have had to go into Natalie's line of work if I was really good at this, Tim. A politician instead of a law professor. But I think most people at least know somebody who has died or been impacted by COVID-19, who's lost a loved one. 11,000 people across Canada. And I think, we have to focus on who those people are and our connectivity to them. And I also do, though, I have sympathy to some extent for the exhaustion, because I feel it too, of all of this, of all of these measures. And I think in part, I was with those at the beginning who thought that the response should be calibrated, not too hard, the Goldilocks, the balance. And I think in hindsight, that was a mistake. I think we should have gone hard, really hard. We should have locked down everything and as much as we can. And then we would most likely be in a far better position, more like the Atlantic bubble, instead of looking at and living through the second wave and going on into a third wave and on and on. People are exhausted and over it, partly because this is just, it's become a marathon, more than a marathon, it's become an ultra marathon as we're dipping in and out. So I think partly we're now paying the price for not making those hard choices early on. It is hard to have to accept that perhaps we need to do that now. Some people will be fine, their families are fine, but we are very much connected with other folks too. And I think that their lives matter just as much. So I see people on, my newsfeed and stuff saying, well, these deaths are all in long-term care homes. And I really rail against the ageism and sexism and all the isms that go into discounting those deaths. So that's what I would do. But I'm sure there would be a better way. You're the expert of public communication. I think you should tell us how we should do it, Tim.
Colleen, I get that there are only people over 70 who are dying. I get that. I think almost daily I have someone say that to me in response to these proposed policies. The other thing I want to put to the panel, and something that I think is you hear often, is the scientific uncertainty, right? So they'll say, we can't infringe. I think all of you touched on this in the context of the precautionary principle, but I think it's really important to articulate this also and drill a little bit deeper. We can't use these, or we shouldn't, in a liberal democracy, we shouldn't be using these restrictions because the science is so uncertain. The science about the value of masks is still evolving. The science about who's infected and when they're affected still evolving. Therefore, it's wrong to impose these restrictions. Natalie, maybe I'll go to you first, but I'm curious what everyone has to say on that briefly, and then we'll get to a few questions from the audience.
Actually, I don't think that the courts will buy that. There's uncertainty on science in all sorts of ways, and they decide not only on COVID, but there was uncertainty on what to do when you were faced with terrorism. There was uncertainty as to what to do to curb obscenities, and they often chose the precautionary principles. They often chose the fact that governments are able to have some room to maneuver in the context of uncertainty. So my thing, I don't think that the cases will be won on that ground. To respond a little bit to the fact, and I also think it was interesting to hear Colleen say, oh, maybe we should have gone harder earlier. My reading also of the public health domain is that part of going as in terms of the least infringing ways is also part of the thinking. So I think, hindsight is always 20/20. I am pretty sure that what we expect decision makers now is to understand the complexity of the situation, the complexity of having people that are not only fatigued but despaired, and how do you develop a public health model in that context? Do you continue to say blame and shame? Do you bring in the police? How are you going to deal with that lack of credibility that's now a little bit as seeped in? Or do you actually continue to say, well, it's a balance where, we are in trying to get to the other side. There will be some measures that will be maybe too harsh, others maybe not harsh enough, but overall we are measuring not only just, I don't think it's just the number of cases, it's capacity for hospital. Have we increased the capacity for hospital? Have we increased the ability to minimize the risk in some populations, long-term care homes, or racialized communities where the risks are high? So I think we expect from the system to learn and to be constantly learning and being prepared to explain what's going on, where is the uncertainty, and some of the things that we've learned. I mean, the case that I mentioned about the complete prohibition on family members accessing long-term care, that has been reversed, because now we know that probably that was just not the right call. But that's okay, provided that there is an ability to respond to these challenges with the best information that's available.
Natalie, I think that's a really important point, and so often these discussions are portrayed as if it's a dichotomy, right? This full lockdown versus herd immunity approach, when really every jurisdiction, almost every jurisdiction in the world, is trying to strike a balance, and they're doing it in various ways. Some may perhaps not as well as others, but this balance is trying to be struck. Irfan, I want, if I could, put you on the spot a little bit about the evidence, right? Because we do hear this all the time. The masks I think is probably one of the best examples. And Colleen, I was a lot like you. Early days. Let's see what the evidence says about these measures. But as we learn, I think some of the big measures, masks, physical distancing, being responsible, washing your hands, being responsible when you have symptoms, the evidence is there. Am I overstating this?
I don't think you are. I mean, even on masks, even in January, February, March, we knew that masks protect wearers. So healthcare professionals have always used masks to take care of people with respiratory infections, and that was protocol from day one. I think there was some uncertainty at the beginning about whether masks would be protective in the community, and some question about whether, you know, people would touch their faces and so on. And so as the months have gone by, though, you know, we do know at this point quite a lot about the virus, right? We know how it is transmitted. We know its incubation period. We know that masks protect the against, you know, they protect the person with, they prevent the person with the infection from transmitting to others. And that's probably mostly how they work in the community. We know physical distancing works. We know what the infection fatality rate is. So going back to that example I was giving earlier, we know if a healthy 44-year-old gets infected, roughly what their chances of dying are versus somebody who's in their 80s. We know that testing, tracing, and isolation works. You know, we know that actually a robust test, trace, isolate system can prevent more than 95% of infections. We know travel restrictions work. Actually, I think, you know, it's been really interesting as a physician trained in science to sort of see this all play out in the media and in the public over many, many months, and just realize how, you know, we probably haven't done as good of a job over decades. And I know you study this, Tim, and talk about this a lot, how we haven't done as good of a job as we ought to have done in ensuring that people are numerate, that people are scientifically literate, that people can actually discern what is true from what is not true. You know, the Great Barrington document that was released some months ago, and, you know, for folks who don't know, there was a document written by 3 academics, one from Stanford, one from Harvard, and one from Oxford. So, you know, classic fallacious appeal to authority. You know, you wonder what would have happened if it was 3 people from smaller universities that nobody had heard of. These 3 people wrote a document together basically arguing that we should just, you know, largely let the virus course through the population while we try to protect people who are, I think, seniors and people who are vulnerable in other ways. And that document, you know, it didn't have a single reference. There was no study that they cited. You know, they had a website, but there's no evidence on the website at all, no links to any research studies. And even some of the papers that have been published during the pandemic are not great quality. You know, the scientific world is such right now that it's easy, or it's at least possible, to get almost anything published in some journal somewhere. And so it's very difficult for the public and for journalists to, I think, understand what is true and what is not true, and discern through all of this, you know, this literature and this information. And, you know, sometimes you'll hear people, I saw a quote the other day that I really liked, which said, trust science, not scientists, because scientists can make mistakes. But still begs the question, well, what do we mean when we say trust science? And who gets to judge whether it's good science or bad science? And so I come back to the fact that, you know, we haven't done as good of a job in elementary schools, junior high schools, and universities in really making sure that people have the ability to understand what is true and what is not true. And Tim, I'd be really, you know, interested in your thoughts on this, because you've devoted a good portion of your career to studying this, understanding this, explicating this much more than most.
Yeah, I think you're right. I think especially when it's a topic that's complex, you've always got to turn to the body of evidence, right? You've got to, you don't look at one study, you don't look at, you know, one small methodologically flawed study. And I think particularly in the context of something like civil liberties, when the courts are going to be looking at these things, they are going to be looking at the body of evidence, right, Colleen? They're not going to be looking at just one study. They're going to want to know what the scientific consensus is. And I think one of the great paradoxes here is that in the context of these big interventions that we're talking about, these really straightforward things, the body of evidence is there. You know, my friend Judy Ellis raises the point, so many of these things are like seatbelts, right? You know, they're like seatbelts. You know, you could go your whole life not wearing a seatbelt and be totally fine. But that doesn't mean that seatbelts are bad social policy. We know what the science says around that. Okay, so I'm gonna shift us to another big topic, which is it's going to be a big one, and it's getting more intense. And this, of course, is vaccines. We have a question about that. I think there's no doubt we're going to start to see some civil liberty questions around vaccines, particularly if people start talking about mandatory vaccination. Colleen, do you mind jumping in on this one?
Yeah,
because I think it's going to be a hot topic.
Absolutely. So on the question of the vaccine, there's already a lot of ink spilt about who will get the vaccine. So how will we set priorities? Because at first we won't have enough for everybody in Canada, let alone the world. So how will it be allocated? And this kind of comes back to my point that when we talk about civil liberties, we're not actually talking about human rights in the sense of positive rights to demand of governments that they provide us a healthcare resource. So that will be a question, who will get it, although I imagine that straight out of the gate we'll be looking at healthcare workers and probably the vulnerable, the immunocompromised, if they are permitted to have the vaccine, the elderly. And then this, of course, raises the question about mandates. So could a government mandate that healthcare workers be vaccinated? And one might imagine, although the science is looking great from the reports, that there may be concerns by at least some about the impacts of vaccination, and they may want to refuse that. And when we think about that, interestingly, it's going to be also whether or not you're able to bring a charter challenge is going to depend on who is bringing the mandate. So if the government is bringing the mandate, then clearly you could bring a charter challenge. If it's a retirement home, a privately financed retirement home, then probably not. So, we're going to have a lot of questions coming out about who is demanding it. Once we move past healthcare workers and the vulnerable, will you have to show that you've been vaccinated in some form of an immunization certificate in order to get into a baseball game or into a football game? And how will they collect that data? So there'll be privacy questions and so forth that emerge there, and whether or not you have a civil liberty right to access a game, for example, if you don't have a vaccination certificate. So there are going to be a whack of issues that come up, and I'm sure others would like to comment on it. But while I have this moment, I do want to go back to Natalie's point about long-term care homes opening up to families. It seems to me that, again, this is an impoverished view of rights. The reason why families have to get in there in part is because we are providing substandard care to the elderly. Out in BC, the medical officer for health was saying, well, we don't have masks because poor people can't afford to buy masks on subways. These are things that can be fixed, right? You can provide people masks. We could have a better standard of care in long-term care homes, so that having a loved one be part of it, accessing isn't so connected with the very health and welfare of the people there. So I think we have to be really careful about this discourse of civil liberties, because I think it's more than the courts. I don't think it's the risk is that the courts are coming in and going to do damage here, as much as this discourse about civil liberties in the sort of common narrative of discussion about the legitimacy of COVID precautionary measures, undercutting the legitimacy of those measures, right? Not the reality of the legal, of how the courts will take it or respond, but this discourse, which I think is problematic.
Yeah, Colleen, I agree with you, and you are certainly seeing that kind of discourse already emerging with the vaccine, from the anti-vax community, and they've been very strategic in using the language of choice, of rights, of consent, of liberty, and we've been following it really closely at the Institute, and that language is used in order to sort of to supersede the lack of science they have to support their position. And I think you're right. I think it's the discourse, and we're seeing that discourse also, of course, with the anti-maskers too. And unfortunately, I think it's been very effective. And there's actually some really interesting research to suggest that that kind of discourse is unfortunately, an effective way to engage the public. Natalie, I'm curious, if you could comment on this, and
Well,
not just in the context of vaccines, but more broadly.
Well, I think that it's civil liberties is not devoid from human rights conceptions, so I think you have to be very careful of opposing liberty to equality. We need both and we need both at the same time. So I don't think that's, and one of the charter rights is certainly the right to equality. So to insinuate that this is a discourse that leads towards some way, it can be brought back. Part of it, I think, is, I think we've all agreed on this, is the ability to explain, and the ability, so the demand for accountability is what is couched as liberty and so on. It's a demand for accountability. Tell me why, and because no rights are absolute in Canada at all, and people know that, but they have the right to know why. That's what the charter guarantees, and I think that's a little bit part of the issue. So my own view is I think it is normal that there be some sense of despair, some sense of challenges, because that's how society is built. I'm more concerned myself about whether there is a defensiveness that comes and says, oh, if you are asking questions, you're a mass denier and you're not taking this seriously. I disagree with that discourse as well. I think it's just as dangerous as the other one. I think a human rights framework that shapes public health policy is very important. That looks at the impact, the choices, and has a very more and more nuance, because it's longer. Now we're 9 months into it. We're probably going to be a year into it. So we have to have a system that responds to the fact that there is fatigue and despair is part of the system now. So it has to be addressed. Otherwise, you lose the whole battle. So that's my advocacy today, is simply, let's not resist the framework of accountability. Let's not encourage governments to pass things saying no access to the courts or of any kind. And let's actually reflect on how do you make good science accessible. So that's where I am.
Natalie, I think those are really good points, and I think everyone would agree that it is incredibly important to listen. It is so easy. It is so easy to anytime you see someone who's raising, being skeptical, to get defensive. And I think it's so important to listen, because people fall in a continuum. Some people they're just trying to make an informed decision about how to move forward. So, I think that is a really important point. We have a question here from Reza Deber, another friend, noting the misinformation emanating from the United States, in particular from the president. And Reza, there is very interesting research to show that it is having an impact. There's been fascinating research to show the dramatic impact that President Trump in particular has had, but that misinformation has had on this discussion. There was a study, Heidi Larson's group from Irfan, you might know her from the UK, did some really interesting work. It's still in a preprint, this study, so I got to say that, but it has found a direct link between the spreading of misinformation and the erosion of vaccination trust, which is no surprise, but it's good to have that data, and also lots of research showing the impact of one person, President Trump, on this broader international discourse. I do want to ask, we don't have a lot of time left, but I real quickly, I have a question, and I'm going to be selfish here and ask it. I'm fascinated about the freedom of expression issue, tying this to the misinformation battle, right? Tying this to the battle of fighting misinformation. Do you think we're going to start to see, I guess this is for Natalie and Colleen in particular, but real quickly, do you think we're going to see some freedom of expression charges when we start to try to think of ways to get these platforms to shut down the spread of misinformation? Because I think that is a really interesting balancing act that we're going to have to start. One of the battles of our time, I actually think.
Yeah.
Maybe Natalie, I'll start with you this time.
Yeah, so a couple of things. First of all, I think, mask will become a freedom of expression, so I don't think it's just, people will argue that being compelled to wear a mask is an infringement of their freedom of expression, because it is a political act or not. And indeed, I think we have lots of case law that say any times that you're told to do something, to wear something, is probably a freedom of expression issue as well. So I think that's one thing we talked about a lot. I think the courts will continue to support mask wearing to the extent that the evidence continue to support it as being a good policy, a policy that makes sense and is reasonable in the circumstances. What you're pointing out, though, is I think a little bit more complicated. My own view is I have no problem with more information, which is, the idea that Twitter says what has just been said is just plain wrong. And, advice is, I think, when we go to shutting down, we're moving to the path of suppressing speech. And I think that the extent that you create victims out of this, that they then get more publicity because you have targeted them. That's what we see in hate propaganda and so on. I'm not saying we're not going to get there, but the threshold will be that much higher. And that will be, I think, a fight that may not be worth it in the end if you continue to have this sort of labeling of this is wrong, this is not the right information, and so on. I think Trump, in a way, has fomented this polarization. So the reason why you have now people that are very defensive about the public health system because they see the other side as max deniers is that was his game plan all along, So I think we've allowed ourselves to be put in that polarization that he has exploited for his own purposes, and we should resist that. He's done. We hope he's done. And but the next the next phase is really to step out of that polarization debate and just look as though it is okay to ask questions, and not all decisions will be perfect. They're perfectible. You could have more nuanced approach. You could eventually decide that shutting down public library could be rethought in a different way. There may be institutionals that the public health has to think about providing solutions as opposed to so that's my point, is that it's a long road ahead. We should support creativity and engagement on broader reflection.
Colleen, real quickly. You have a thought?
I think that, yes, I always have a thought that, you're only going to come to this question, Tim, if governments are actually taking action. So all of this, discussion that we've just had is predicated on that. And the trouble is with the charter, as I've hinted, is that, and Natalie's right, like in lots of great ways, a legal challenge gives accountability, but only on some things. Right, and it's not, it's not giving accountability for failure to act, at least yet, So equality, perhaps, in some circumstances, but if governments, I've just been reviewing a whole bunch of discussion of rule of law and these sorts of things, shutting down courts and so on, all around the world. So different countries, articulation of what has happened from a legal perspective in each of the countries all around the globe. And what's really fascinating is, because there's no context of what's happened in COVID, countries look great when they've done nothing. They've just stayed the course on everything. And meanwhile, deaths, infection have run amok. So without that context, you can't really, so if you look at England, for example, they've done lots of things. All of those sorts of things have gone along tickety-boo, but without that context, you really, what they have done is failed. So we do need to strike a balance, but I think there are some problems where our frame, our legal recourse isn't a big enough tent to include positive rights to healthcare, a responsibility for governments to act to protect health. It's just up to them, and you say, well, we get to vote them out, in 2, 3, 4 years, whenever. That will be too late for many people.
Okay, well, we've actually run out of time, but Colleen, I think you've landed us on a great concluding thought, and that, of course, I think is science-informed balance. In some respects, science-informed compassion. For our whole community. I'd like to thank everyone for this wonderful discussion. I think it's so important. Irfan, you've heard the phrase civil liberties more in the last hour than you have in your whole career, and now you can take that banner forward for us into the clinical community. So again, thank you very, very much for this opportunity, and thank you for the Royal Society of Canada for tackling this topic. Thanks again, you guys.
Thanks, Tim.
Well.
Thanks, Natalie. Thanks, Irfan.